So great to see you.
Nice seeing you. We worked it out. It's power of persistence.
Absolutely. Absolutely. Well, I hope you're having a great Thursday.
Mm-hmm. Pretty good.
Good, good, good. And you got your bottle of Pinot?
Cheers.
Well, cheers to you. That's neat. Yeah, this was the one we were talking about. This is the courtesy of our friend Ross Halleck. Ross does some incredible wine. In fact, the first time I ever went to Ross's place, he had just come back from San Francisco,
mm-hmm.
and he entered 6 of his different cuvées of Pinot Noir, and he came back with 5 golds and the Grand Champion.
Wow,
it's kind of a fun thing. So
absolutely.
Well, that's great. Well, I'm just really excited to have you with us today, Dr. Whyte, and the opportunity that we get to spend a little bit of time together and share and talk and enjoy some fantastic Pinot Noir.
Yeah, and I had some fish tacos beforehand because remember, I'm on the East Coast, so I didn't want to pass out, you know.
Yeah, it's almost 7 o'clock your time.
Yeah.
Well, that's great. Well, I know that there's some people that are joining us that may not be familiar with Project C.U.R.E in general or Pinot. I think everybody knows who John Whyte is, and I'm going to share a little bit of your bio. You know, this Pinot with the president thing is kind of fun. We're sitting in the conference room right here at headquarters in Denver, and before COVID, we used to meet around this conference table and just talk about all things healthcare and kind of what was happening, and just celebrate over a glass of, you know, Pinot Noir for people who like reds, Pinot Grigio for people who like whites, and we would talk a little bit about those things. This year, of course, Project C.U.R.E will ship about 200 semi-truck trailers of medical relief. Canada became our 139th country this year. We started doing some COVID relief for the indigenous groups up in the north part of Canada. And so that would be our 139th country to work in. And
congratulations.
It's a really cool opportunity.
That's great.
So let me tell the group that's joining us just a little bit about you and your background, which is so extensive. I mean, it's to get on and read about what you've done and to watch some of the work that you have compiled on the internet and on recordings and things at WebMD. Very, very impressive. John Whyte, MD, MPH, is a popular physician and writer who has been communicating to the public sector about health issues for nearly 2 decades.
Excuse me.
Bless you.
Thank you.
You don't look that old, my friend.
I am.
Well, I know some of your books are on aging gracefully in the middle ages, and I thought, you know what, I probably need to get those and read those. This is about the time that gets really appropriate. Dr. Whyte is the Chief Medical Officer of WebMD. In his role, Dr. Whyte leads efforts to develop and expand strategic partnerships that create meaningful change around important and timely public health issues, none being more important than the work you've done around COVID. Prior to WebMD, Dr. Whyte served as the Director of Professional Affairs and Stakeholder Engagement at the Center for Drug Evaluation and Research at the US FDA, Food and Drug Administration. Dr. Whyte worked with healthcare professionals, patients, and patient advocates, providing them with a focal point for advocacy, enhanced two-way communication, collaboration, and assisting them in navigating the FDA on issues concerning drug development, review, and drug safety. He also developed numerous initiatives to address diversity in clinical trials. Prior to this, Dr. Whyte worked for nearly a decade as the Chief Medical Expert and Vice President, Health and Medical Education at the Discovery Channel, the leading nonfiction television network. In this role, he developed, designed, and delivered educational programming that appealed to both a medical and a lay audience. This included television shows as well as online content that won over 50 awards. That's amazing, including numerous tellies, the CINE, Golden Eagle, and Freddy's. Dr. Whyte is a board certified internist. He completed an internal medicine residency at Duke University Medical Center, as well as earned a Master's of Public Health in Health Policy and Management at Harvard University School of Public Health. Prior to arriving in Washington, Dr. Whyte was a Health Services Research Fellow at Stanford and an attending physician in the Department of Medicine. He has written extensively in the medical and lay press, and he continues to see patients in Washington, D.C. and Maryland. That, my friend, is quite a bio. Congratulations.
I could have shortened it.
But why? I mean, that's, I love it. I really love it. So in your role at WebMD, and as we come out of COVID, what's the vision for the future of WebMD?
Yeah, and the vision really started pre-COVID, but I think COVID has accelerated and shown its importance. And really what it was is, search has changed. In the past, you'd search up on a topic, multiple sclerosis or, heart disease, you'd print everything up. Remember when everybody would print things from the computer?
Right.
And you bring it to the doctor, and what would the doctor do? Just kind of take it and move it to the side and do whatever he or she was going to do. And now it's really about shared decision making, because what we were trying to do prior to COVID is to say people search for information online, and we have to make sure we give them great content. And COVID has taught us that. There's a lot of bad information out there. But you want to search that content and you want to connect it to care. You want to do something about it. You're concerned about a mole on your back. Why are you going to wait 3 months to see a dermatologist? You have hip pain. You want to know whether you need an x-ray now. So we're trying to connect that search of content to care. So whether it's a telemedicine visit, which we can help arrange, whether it's about apps that you can use to take a picture of your mole to get a read from a dermatologist, depending upon what state you live in, because medicine really is practiced and regulated by the states. If you search symptoms of STDs, we can give you a link to get an STD test without having to go in to see the doctor. And if you think about it, that's what we started to do with COVID as it went on. We didn't require people to go see the doctor. Antibody testing you could do on your own. So it's really this push to connect content to care where patients are more in control. They decide how they want to interact with the healthcare community and when. And that's a big shift. And the other big shift is it's almost like this DIY approach. You mentioned I was at Discovery Channel. We had a show on TLC, which we own, creating spaces. Everyone fixes up their home, rewires their garage. I don't know if this is good or bad, but this is the trend. Everyone wants to manage their own healthcare, partly because the healthcare system hasn't always been responsive. We got wearables, we got trackers, we got sensors. What are we going to do with all that information? And I think that's the next iteration of how do I take what you're doing at home? And that's great because we need to bring more care to the home. COVID has taught us that as well, but then still connect you to the healthcare system.
So really, it's more than an information resource. You're really becoming a hub.
Absolutely.
A healthcare hub.
Yeah. Absolutely. We're more than just a publisher of information.
Yeah, that's incredible. That's terrific. And like you said, so timely. How long have we known that we could do telemedicine, right? But it took something like COVID to really pull that out.
Well, the issues have been, you mentioned I worked in the government. We have to acknowledge payment policies matter. So we still probably would not be doing a lot of telemedicine if we didn't have what's called payment parity, meaning we pay the same for a telemedicine visit as we do for an in-person visit. So that really has accelerated the change. But the difference is now we know that it can work. We know that consumers, patients like it. We know it can work, with doctors. So that really has been supercharged because, before COVID, it was like 2% of office visits were virtual. Right. Then in the middle of COVID in the summer last year, it literally was like 80%. Still far fewer visits. And now it's probably 40 to 50%, depends a lot on specialty, depends why there's the visit, but why should you go see the doctor for a prescription refill? for, a follow-up visit on high blood pressure, if I can also give you some devices to do at home, as we have pulse ox, other medical quality, medical grade type of instrumentation, that's really the future. And that's going to be good for everyone.
Yeah, yeah. Well, you recently celebrated the 1-year anniversary of your WebMD program called Coronavirus in Context. I think you interviewed something in the neighborhood of 230 people, top government officials, scientists, physicians, media influencers, cultural icons, former NATO commander, business
Yes,
people,
General Wesley Clark. Yes.
Right. Well, and the guy from Denver, Tim Tebow, he was on your show too.
Sure, he's been on a couple times. Yeah.
That's awesome. So here's this huge, diverse group of people, and you got to talk to all of them. Were there one or two sort of major themes that came out of those conversations?
Yeah.
You could say,
one of them was about that this is a new virus. I mean, it's called the novel coronavirus, and we have to follow the science, but also recognize that the science changes when it's new. So, at first they said didn't wear masks, and then they said, wear masks. That's not a bad thing. That's replying and acknowledging that the science changes and that we need to be guided by science. Even now, whether it's 6 feet in schools, we have more data, and then it's 3 feet. You can't hold on to your previous beliefs and have to be open to that science changes and be responsive. But the other key message, for which a lot of non-scientists talked about as well, is this idea that we have this infectious disease pandemic, but we also have a mental health pandemic. And that's going to continue much longer than COVID. And we have to be preparing now to really address the challenges that people are having, the PTSD that many healthcare workers have had, the challenges that we've all had with loneliness and depression. So it's really about, it's a mental health pandemic, and we need to be kind to ourselves and others. And then, the third one is, we like to say that information is power, and it's nice to be powerful, but information is not knowledge. And where you get your content and the credibility of the sources is so important when it comes to things like COVID. A lot of misinformation out there still is, about the vaccines in terms of changing your DNA or giving you COVID. And that has been one of the other key messages, that we really need to work hard to provide credible, useful information for people that need it at this hour when it's really quite critical. So it really has been a learning experience. I've been doing it every single day since it started. Usually not the weekends. They let me have a break on the weekends. But it's been great in the way that I've really been able to cover a topic in detail, literally every single day, that you often don't get. But it's, I have a great job because I've been able to talk to lots of interesting people like you do. And it's really a lot of fun to talk to a variety of people, the Dr. Fauci's and the Deepak Chopras and the Ariana Huffingtons, and then, regular people as well, in the sense that, don't have notoriety, but were one of the first people to be part of a vaccination trial. Others that are, really trying to iterate it, and really some young kids that, really have risen to the challenge. And I remember this one gentleman, Taffoli III, I still remember it. He said to me, he wasn't alive around September 11th, or very young, and he saw how firefighters ran to the fire, and he wanted to be like them. So he started a mobile testing van, which is really, I don't think I could do that.
Yeah, that's incredible.
Yeah, and raised the money, and, trained, got trained in it, and really is making a difference. Because remember, with the whole issues with testing, you had to go to places. He was going, to the underserved areas in the communities. Yeah. So really exciting stories.
Oh, that's fantastic. That's fantastic. That whole dichotomy between truth and you called it, knowledge and information. And And the internet, there's really no penalty, if you will, for putting something out. I mean, if back in the day when you had a big newspaper, you had this huge infrastructure, and there was a
Mm-hmm.
building and printing presses,
Mm-hmm.
and you had all the reporters, and if you lied, frankly, you'd go out of business, and that was very expensive. There's no
Yeah.
penalty right now to lying about things, is there?
I mean, you get rewarded for being provocative by
Right.
the way that search works. So even if you get negative engagement, you rise. But the other thing that I learned from this as a physician, as someone interested in public health issues, we really learned the relationship between public health and business. And nobody
Hmm.
has really thought about that. We kind of poo-pooed public health. People don't really know what it is. They think it's water sanitation or food for the poor. That's not what public health is.
Right.
Yet businesses have not been able to reopen in many areas, of the country, especially during the pandemic, because we didn't have an adequate public health infrastructure. So I don't think anyone is going to question the role of public health, especially as it relates to the business world. You can't function if the public isn't safe, and their health is protected. So that's an important lesson that we learn. And I hope we start to fund public health departments like we should be doing and need to.
Right. Well, along those lines, I'm curious. I mean, that's one big learning
Mhm.
lesson that we're going to
Yeah.
take out of this. What are some other things that you would look back and say, well, out of COVID, we learned this?
Yeah. It kind of goes to your point about the role of telemedicine, but it's the broader aspect that we've talked about in terms of patient centricity. So we always used to say you can't do chemotherapy in the home, like that's too dangerous.
Yep.
And we learned actually in many circumstances, you can deliver chemotherapy in the home. You can do clinical trials in the home. You can deliver a lot more care in the home. And isn't that how we should be moving healthcare, where the patient is the center of everything? And that hasn't been traditionally what it's been. It's been the doctor's been over here, and everyone wants to keep the doctors happy. Everything is focused on the doctors. Shouldn't it be focused on the patients?
On the patient.
And I think COVID has taught us the importance of that, and how many things that we actually can do in the home and the use of technology that we never thought we could do. Even the idea that seniors are too old, they won't be able to do it, they won't be able to function well on it. We learned that's simply not true. So I think that's a very important lesson. Yet at the same time, we've also learned, I think, a lot about that. How do we communicate to people? And let's be honest, we've had lots of challenges because we have not had proper communication from our leaders. If anything, it's been conflicting. And even at the
Sure.
CDC, a prized, institution, they were changing their guidelines literally every other week at some points during the crisis. And we've learned that doesn't inspire confidence, and that's unfortunate. And we also learned that even science becomes politicized, and how do we avoid that in the
Mhm.
future? So but the positive side has been on the lessons learned in terms of there's so much more that we can do in healthcare at home, and really making the patient the center of the
Mhm.
healthcare delivery system. And we may have said that in the past, but that never was the case. And now I think we're making those changes, and that's exciting. And then we've learned a lot about digital tools that
Yep.
that we can be using that were already happening, but have been accelerated.
Hmm. Yeah.
There's some silver linings from all of this.
Yeah. No, I think that that's absolutely incredible. Um, and really, some of the, like you were talking about, the role of business.
Hmm.
As people are coming in, and they in our office, they come into work. What is it that's our role to keep those people healthy? Right? It's not well, you're at work now. It's different
Hmm.
than if you're at the doctor's office later, and that's different than if you're at home. I mean, there's a
Hmm.
melding of all of this
Absolutely.
together, isn't there?
Absolutely. And in many ways, employers now are struggling because they're not sure what to do about return to work. This isn't their area of expertise. And how do they really work with the public health community and figure out what's going to keep employees safe, what's going to keep customers safe, depending upon the type of industry that they're at, and continue to be able to meet their economic responsibilities. I mean, it's a balance, and we haven't always addressed that in the right approach.
Right.
I mean, there's been a lot of missteps here, but hopefully we'll learn from it. I hope, and avoid them in the future. And this is the type of pandemic that occurs once a century, so we were overwhelmed as everyone was.
Yeah. So we talked about telemedicine as being probably one of those things that will stay the same.
Mhm.
Do you see other things that we have learned during COVID that whether it's the digitization of health that will remain? And then where do you think that the sort of magnetism of the past will bring us
Yeah.
back to the way things used to be?
Well, I'm hoping it will make how things should be instead of necessarily how they used to be. So, what can we leave in the rear view mirror at the time that we can look back? And then what can we bring forward, to make it better? I think there's been so many new tools, especially digital tools. And also, as we talked about before, apps and devices. Honestly, I never used a smartwatch or a Fitbit prior to the pandemic, and I didn't think I would want it. And now I really like it because it's giving me a lot of data. And where I think we're going to have a lot of advancements is the challenges. We have all this unstructured data now, right? Got my Fitbit giving me information. Your bed can be giving you information about sleep. Alexa is giving you information. How are you going to use all this unstructured data, structure it to improve your healthcare? So I think that's going to be a big advancement in terms of patients, consumers are going to have their own data, and they're going to be in control of their data. But then how do we connect it back to the healthcare system and have positive outcomes?
Sure.
I think the issue of work from home, how do we have that balance? How does that give people more happiness, more time with family? What are their priorities? I've always traveled for business. I don't think we'll have as much of that anymore. Even though there's still that desire to meet with people, that's always going to be the case. But do you need to do it every week, every other week? Probably not. And that could be good. It gets harder on your body,
Right.
as you get older. So it's also, I think, a reset for people, for many people that have given them the opportunity to think what really matters to you.
Sure.
Like for me, I normally don't get to have dinner, with my kids. My kids are young and my wife, because we get home later
Yeah.
typically. But, now we're home all the time. So we
Right.
literally have had dinner, 365 days in a row, which is very exciting. So that's what's, I think are one of the changes too, as we learn about that.
Right. Well, it was such a shock back last March when,
Mhm.
I think we probably travel, a lot the same, a couple 100,000 miles a year sometimes. And all of a sudden it just went from that to no travel at all.
Mhm.
And there's days when I'm just really not looking forward to going back. This has been kind of nice.
Yeah.
Yeah.
No, I feel the same. I mean, certainly in many ways, it'll make those trips that you do go on, more interesting because you're not doing it all the time, and look forward to it. But, to have the schedule where it's, every week is tough. And I think there's reasons to think, how can we do it better? So I think there'll be a lot of lessons learned. It'll be iterative, where we'll continue to see. Will it go back completely to being in the office 5 days a week? I don't think it will, because people were already moving away from that anyway,
Sure.
for the most part. So now there's an opportunity to do that even more. I mean, there is a component of the culture of the work environment, of what matters, that idea of collaboration. But in some ways, what I've been hearing is, instead of dividing the employees, that some are there Monday, Tuesday, Wednesday, and others are there Thursday, Friday, maybe everyone will be there in a post-COVID world Monday, Tuesday, Wednesday. And then everyone works at home on Thursday and Friday. Because in some ways, I don't know how you feel, it's worked because everyone's on Zoom, everyone's on Teams, or whatever it is. it's always difficult when some people are in a conference room and some people are on the phone. Like that's where it always has been challenging. But if we're all in the same type of platform, I think it works better
Yeah,
that way. Um, so it'll
sure.
be interesting. It'll be, getting some used to, but I won't mind the long commute. Sometimes I do a little when I've been driving. I haven't driven much at all, but I'm like, oh yeah, that's where I listen a lot to the news in the
Right,
morning, or I just kind of composed myself listening to music
right,
in the morning. And I don't get that because I'm not,
sure.
driving. And I think we have to go back to the boundaries of work and life, that we're all answering emails very late at night, and
Right,
don't have the limits that we do.
right. Yeah, there's a big space for mindfulness and intentionality coming out of this, right?
Yeah,
Yeah.
absolutely. I did a mindfulness exercise with Deepak Chopra the other
Oh, did
day
you?
for a show, and what I learned about it, which I had known, everyone kind of thinks it's something that you have to do for 30 minutes.
Yeah,
It's really not. There's just a lot of days where you just need a couple minutes to yourself and to detach, and I found that useful as well.
yeah, that's incredible. Well, I know you've had quite an experience on the international front too,
Mhm,
and up until COVID, that was pretty much exclusively what Project Cure did was
mhm, mhm.
work in those places where, I mean, people are working 12 hours a day
Yeah,
and they're making $2,
I
$3,
know.
and it's just really tough. Um, and so coming out of COVID, as we're sort of emerging into the vaccine stage,
Mhm.
I know there's a lot of conversation around uh, international
Mhm.
disparities, right?
Absolutely.
Testing,
Yeah.
vaccine, and we're seeing it blow up. I've got
Mhm.
friends in Africa that are just saying, we don't know how bad it is
Yeah.
because we can't test. And,
Yeah.
2024, 2025,
Mhm.
maybe we get a handle on it in some of
Right.
these countries. What's your reflection on the
Yeah.
international disparities in general, but especially with COVID now?
No, you're absolutely right. And if anything, COVID has exposed the disparities that exist in this country, but also around the world. So yeah, I actually have been working with folks at the United Nations around this messaging of that we're not safe till we're all safe. And as you know, if anything, I think lately we've been very focused, and I get it, just on America, or Europe is focused just on Europe. And we forget in an infectious disease pandemic, you're not safe if everyone here is vaccinated and we get rid of cases, because someone that travels in from the developing world or an area of the world that hasn't been vaccinated is just going to reintroduce perhaps a variant, or everyone's not going to be 100% infected. So it's really helping people to understand we're not safe until we're all safe. And to be honest, there's many areas of the developing world that no one has received any vaccine, not at all, in terms of even first responders, healthcare workers.
Yeah,
And there's talk about, as you point out, they're not going to get it till 2023. That's not a mistake on my part, 2023.
right.
So how do we address that? And part of it is, some countries are stockpiling vaccine 5 times what they need. The United States is doing that. And do we need to think about, do we need all of that stockpile? Can we give that part of it to those countries that are really in need right now? That helps protect our national security as well. So we really have to have a recognition of what's happening in the developing world that has very little resources. And you're right, it's not just about vaccines, it's about testing, it's about medications. There's no monoclonal antibodies in the developing world. So we really have to have this global philosophy and global approach, which is going to address all those other issues as well. You can't talk about education and clean water, uh, and sustainable energy and food sources if you don't have a population
Hmm.
that is healthy. and
Right.
and that's the big issue. You have to address this first, and I think the current administration recognizes that, has rejoined WHO, the World Health Organization, has talked about making vaccines available and really working with pharmaceutical companies as well to help spur development and reach in the developing world. That's a critically important point that we can't lose sight of. And, people have been calling it's a vaccine nationalism, that you're just keeping all the vaccine for yourself. That actually won't keep us safe. So we
Right.
really have to start thinking about the developing world as, and I'm not saying we should ignore our own world by no means, but we might be able to do both in a little while.
Yeah. Well, I think this is one of the takeaways, back in the mid 90s from the AIDS crisis that we saw. I remember going into places like in Rwanda where there was 2 and 3
Yeah,
people in a bed, and 80% of the hospitalized patients
right.
were HIV positive or full blown
Yeah.
AIDS, and and it seemed like the world at that time really sort of came around that issue, didn't it?
I give Mr. Bush, George W. Bush, enormous credit for PEPFAR
Right.
in really making antiretrovirals available in Africa, sub-Saharan Africa, and other countries around the world. He
Yeah.
deserves enormous credit for raising awareness of the need for medications to combat AIDS. And it really was an international approach, whether it was dollars, but also medications. Again, taking the politics out of it and addressing the need that exists. And you deserve enormous credit as well for always thinking, how am I going to get medication um, to folks around the world that need it? And that's really critically important.
Yeah, that's
I see
amazing.
some folks from Nigeria are saying hello, and then and that's been a point where we really have had to address HIV, but did through PEPFAR and other resources, and we need something like that in terms of um, COVID-19.
Sure, absolutely. Well, and then we've got all of these other, public health issues. I know, in the United States, I think our maternal mortality rate is about 6 or 7 per 100,000.
Yeah.
And in some of the places where you've been, Dr. Whyte, and where we've worked, that's 4 or 500 as it compared to 7. And part of my concern is that we're going to eclipse some of these issues with the pandemic, but
Mhm.
mommies are still having babies, aren't they?
Absolutely. And we can't be proud of how we're doing in terms of infant mortality. And it's primarily women of color, brown and
Hmm.
Black women, where we have the highest infant mortality. And in 2021, how does this still exist? It's a real challenge, and a lot of it relates to prenatal care and availability of good prenatal care, as well as when you're delivering a child, if you're doing it in a safe environment, if you have access to higher level care, if you need it. So there's still work to do, but I agree with you. I think there's a real risk of it being eclipsed. We also have to recognize we have limited resources in a post-COVID world. We can't do everything. We just can't. And there's going to be tough choices. And they're going to be important discussions. So do you build the new hospital wing, or do you focus more on the social determinants of health? Having grocery stores, and there's still food deserts around. People don't think there are, but even in DC, in certain areas, there's one grocery store for an entire region, and it's usually the poor areas. And in others, there's like six, in a 5-block radius. So how can that be? And then you tell people to eat healthy and eat
Right.
fruits and vegetables, and then it's just not realistic as well, especially if they don't have a car or public transportation doesn't always go to those areas. And there's a lot we need to focus on, and we can talk another time about how important the typical in healthcare, we think about access to the healthcare system and high tech, and those are all important. But there's lots of other things that impact a person's health and their life expectancy, including education and other resources. But what's frustrating, I'll tell you, is we're at a point of time that your zip code matters more than your genetic code. So how can that be? How can that be? In Washington, D.C., it's only, a few 100,000 people within a 5-mile radius of the Capitol Dome,
Yeah.
5-mile radius. You have these tremendous disparities, roughly 20-year life expectancy difference. How can that be?
Right.
One of the world's most powerful cities. It's the same in Boston. I like to joke, you can't spit and not hit a teaching hospital. there's, a, there's a gazillion. So, so how do you have these, stark differences in life expectancy based on the color of one's skin in a city? So it shows you that it's not just about tertiary care centers. It's those other aspects of our lives, that impact our health.
Sure. Well, I think it was Bono from U2 that said, where you live should never determine whether you live.
That's right. And it does. Let's put it out there. It does. And when we need to address that.
Well, a lot has been made of the Sustainable Development Goals, the SDGs. Came out of the Millennial Development Goals. And I think it's goal number 3 that really addresses health issues. You got poverty as number 1, and there's 17 of these. It was easier for me to remember when there was only 8, but now there's 17. I just got to focus on 3, on number 3. If you, and you have a bully pulpit, which is amazing. If you were given advice to everybody from the WHO to nonprofits like us to whoever about attacking that SDG number 3, what would you say if you could wave a magic wand and say we're just going to fix SDG number 3 right now?
Yeah.
What would we do?
And as you know, there are no easy fixes, but there are a lot of competing priorities. So as you talked about, there are 17 goals, but in your life, in my life, we have a lot of competing priorities and what we need to pay attention to. And I think part of it is helping people understand why it's important, why they need to contribute time, why they need to contribute limited resources. But it's also about for government and nonprofits, it's about messaging. I'm bombarded by messaging all the time. How are you going to make me interested in this? Why should I care, right? So why should I care about these goals, whatever they are? And I don't think we often do that. We just assume they'll be interested, want to do something because we are. And there's still a lot of work to do that. I learned that at Discovery Channel. It's the power of storytelling. That doesn't mean you just tell a story. It means you try to educate people and entertain them at the same time to then bring about some action. And that's what I think the weakness is of some agencies and even some nonprofits. And it's been my own weakness at times. We put out a lot of data because we think people are going to respond to data, but they don't. They tune out. And that's where we need to have some improvements. Even the fact that there's 17 goals, like I would advise them that's not a good strategy.
Right.
You know why? Because people think, oh, I need to get all of this in because people are going to pay attention. Well, guess what? People aren't going to pay attention. They dropped off after number 4.
Right,
so you need to think of a good strategy.
Isn't that the rule from the courses on public speaking, right? You probably should have more than 2 points. You should never have more than 4 because people can't remember past 3.
Yeah. And we have learned in things, I give them one credit is odd numbers do better. So, 3 reasons why you should do this. The top 5 things you should know about this. Now, it's usually not 17, but but they did pick an odd number. Yeah.
Right.
And I think we have to get more people interested in the global perspective. That's the challenge too. We're all so focused on our own life, our own community, our own country, and don't always have that global approach that is really universal, literally, in terms of how we need to address things.
Yeah. Well, and it's, I see the statistics in the United States as to how many people actually hold a passport. And it's kind of tough because you think, well, we've got such a big country. To go from Boston to Phoenix feels like you're going, nation to nation, but we're all in the United States.
Yeah.
And some folks they'll ask the question, well, why would I want to go there, wherever there is? There's an answer to that. And one of the answers is because there's really interesting people on the other end of that airplane flight, right? It's more than the food. It's more than the tourist attractions. It really is about people.
Absolutely.
Yeah.
What is the percentage? It's not too high that has passports.
No, it's less than 50%, my
Yeah.
understanding.
Oh, absolutely.
And
Yeah.
I had heard that it was down around 20%. I tried to find that out and I got some conflicting data.
Yeah.
Back to your point about information versus knowledge, right? I have information I don't know.
That's right. That's right. That's a good point.
Well, you talked about the food desert issue, and I know one of the things that we have seen is as countries begin to become more
Hmm.
economically
Hmm.
well off, it seems like there's an inverse relationship between that and the quality of food sometimes that they eat. I was
Hmm.
reading statistics where I think our friends in Mexico drink more soda pop
Yeah.
per liter per person than any place else in the world. And it's almost as if, now I have some affluence and I don't need to eat the beans and rice and the
Right.
healthy vegetables and the things. I can buy
Hmm.
pre-processed foods.
Yeah. That is exactly right. One of my fondest memories at Discovery Channel is we did a show on the global epidemic of diabetes.
Yeah.
Literally traveled every continent except Antarctica. But the theme of it was as countries become more developed, their incidence of diabetes increases dramatically.
Right.
And it's to your point. So now they're not as physically active because they're not in the farms. They're not taking as much time to cook and go from farm to table. They're doing a lot of processed foods. They're eating a lot more sweets, a lot more confectionery, which in general they otherwise would not have been able to afford. I heard this great theme, not great theme, but I heard this theme I still remember in India that talked about, and you'll probably, have seen this, to be big, meaning heavy, is to be successful
Right.
because that shows that you have money and you don't have to, struggle to eat. And it's not surprising at all because it's the quantity of the food and the quality of their food and the lack of exercise that are causing some of these challenges. I mean, it's great that folks are becoming more successful and prospering economically, but then, without health, there is no wealth. We like to say that, and all too often we forget that until we're much older, and then it's sometimes hard to recoup the health that you kind of foregone.
Sure. Well, I mean, we've heard for years and years that, there's certain things we should and shouldn't do, that eating right is one of those.
Mhm.
Smoking would be another one.
Mhm.
I'm always just perplexed when I go to a hospital and there's a cluster of nurses out back and they're smoking. I'm like, do you not see the guy up in, floor 6 with
Mhm.
COPD and emphysema and
Mhm.
stop smoking? But this whole mask thing has been kind of an interesting thing too, isn't it? What's the role of individual responsibility with
I mean,
regard to this?
there's a big role for individual responsibility. The challenge is people are conflating it with their rights and, freedom of speech. And again, it just was improper messaging from the beginning. Whereas, they've done some studies, particularly in Asia, when the pandemic first broke out, which traditionally have had more of a mask type of culture. But you saw almost immediately Singapore, some other countries, everyone as a community masked up. There weren't these, places where there were battles and literally fights that have occurred, including shootings over their right not to wear a mask. So I think we do have these challenges in some countries, including our own, with that sense of individual responsibility. Because the difference is, we forget, in a respiratory virus, if you choose not to wear a mask, you can be infecting a lot of other people.
Sure.
And that's just not fair. That's not right. As opposed to if you want to eat bonbons all day and, become overweight, there's still going to be an impact on the healthcare system, but you're not making someone else overweight and potentially impacting their lives. In this, you are. And that's the challenge. And, what's frustrating goes to your point, people were trying to make good decisions. There was a lot of misinformation on that. And I joke, everyone's an armchair epidemiologist that are experts because they're a commentator, online or,
Right.
on a network, but they're not always, experts. What I say is you look for consistency of messaging. You
Yeah.
look for, is this corroborated elsewhere? What are other people saying? And then sometimes using common sense, as well.
Yeah. So besides COVID, what are some of the other things that keep you up at night?
Certainly, COVID does, but it's that general sense of the overall health of everyone, myself or, family, the community, because many people have delayed care. That's what I'm concerned about. We know that cancer screenings will way down. We know that people have been gaining weight, the risk for prediabetes and diabetes. And I'm concerned that we're not going to get enough people to come back to the healthcare system. And 1 year delay is going to turn into 5 year delay, is going to turn into bad outcomes. And I bring up the example. I've seen a lot of patients over the years. There's always somebody with a derm lesion every other month. That often is very concerning, and it's big, and sometimes it's even on the face. And you say to people, well, why didn't you come in sooner? And sometimes they just get used to it and they don't think about it, or it didn't hurt, and it's usually bad. And that's what I'm concerned about, that people just aren't going to come back at all. And I joke, it's everyone cancels their colonoscopy. This is pre-COVID. They always have a reason. And I joke with them on it. It was always like, oh, was it that day? I didn't know. Or they're like, oh, I didn't have a ride. I've heard that a lot. I didn't have a ride. Because technically you do have to have a ride
Right.
to go home. Obviously, you can't drive yourself.
Right.
And then all of a sudden, it's like 3-4 years before you're able to get them to reschedule. And luckily, colon cancer is slow growing. But some other things are a challenge. I'm concerned about the people that had heart attacks and strokes, early signs, and didn't come to the emergency room because we told them not to come because of the COVID. Those would be the exceptions. So that's my concern. And to be honest, I am concerned, and I live in the DC area, so maybe I'm more attuned to it. I am concerned about how partisan it is, and that how the level of vitriol. Like, if you have a good idea and you're not of the same party, I automatically don't support it. And that's just crazy. And I'm concerned about that in terms of the direction of the country. So that's a concern too. And I'm concerned. I have young children, my wife and I do, and I'm concerned, are they missing out? If we don't address these issues with the schools more effectively. And I don't think people have paid enough attention to that, the impact on kids during this.
Yeah. It would be nice to get back to the days when Ronald Reagan and Tip O'Neill would walk across the street and share a scotch and
there you go.
Yeah. And go home, right?
Yeah, it is so partisan, and that is very disappointing. I mean, even the discussion, they're like, oh, you only have, the first year or two to get things done. Well, that's crazy. Like, it shouldn't be like that. And, I'm hopeful, but the trends aren't good in terms of each year it seems to be getting a little worse.
Yeah. Yeah. Well, maybe this will be a good time for a reset on that button too.
Yeah. But I do think, to your point, there'll be some good lessons that we've learned from this. And I think there'll be some exciting changes to the healthcare system that will benefit patients through all of this. And I think we'll see continued acceleration of a lot of digital tools and apps. That's exciting. Real quickly, I saw this toilet. Like, this is the future. I'm going to say future's going down the toilet. So you put this little sensor on the toilet. It's an Israeli company developing it. So literally, it is monitoring your stool and your urine every day. So it's looking for blood in the stool, perhaps for cancer or for hemorrhoids. It's analyzing your urine, perhaps for ketones to say diabetes or for a UTI. I'm like, that's the future of healthcare in a way. Literally, I'm monitoring you every single day. That's like the true early warning sign. And that's not the fancy, glitzy type of thing that people, want to have to go in your arteries and open them up. And that's important too. But it's some of these other, basics that are important that then you also have control of. So you'll see it first. So I think those are all going to be accelerated by what we've learned during this lockdown and the pandemic.
That's very cool. Well, I want to get you back to your family. I'm curious, just as we wrap up, you've got such a great career and so many distinguished things. If, from your perspective, what are the 1 or 2 things that you would look back and say, I'm most proud of this, or I'm happiest with this?
Yeah, I'm very proud of some of the work at Discovery Channel, as I talked about, educating global audiences on some of these themes, such as diabetes. We didn't talk about my time at Medicare, where I helped set up the review process by which decisions are made as to whether or not we'll cover certain services. So, that's a big deal. And then, at FDA, I had a big opportunity to create a new office, which is really about engagement. How do we focus on new outcome measures that are clinically meaningful to patients and raise awareness about the lack of diversity in clinical trials? So in many ways, I feel like that, will have a lasting impact. And then, I appreciate all the patients that I've seen over the years and being able to have an impact on their lives and, share in their lives. But, I'm very much probably like you, someone who always looks forward in
Sure.
terms of like, what can I, accomplish next? Hopefully I'll have a lot more years. I joke to my wife, I'll be like the Supreme Court justices working in my 90s or 80s, 80s and 90s, not retiring,
Right.
So, because like you, I think we all want to have an impact. And I have this paperweight on my desk that says the purpose of life is a life of purpose. And in many ways, I know you feel that way in terms of what you're doing in helping various communities. So I always look to what can I do next? Hopefully I have a few more hymns to go.
That's great. My dad had an uncle who lived to be about 6 months this side of 100.
Wow.
And his philosophy, he had about 5 careers. And I asked him one time, I said, one of his last careers, he was a pastor and a chaplain in the Army and all this. And I said, Uncle Chester, you could have retired a long time ago. And he looked at me and he says, retirement is not in the book, and he means the Bible, right? And he says, that's not supposed to be. And he'd probably still be going. He broke a hip, got some pneumonia, and which is a tough thing. But man, he was a hard charger, and I just thought, you know what? There's, to your point, there's a life of purpose, and it's the legacy that we leave, right?
Mm-hmm.
That's neat. Well, Dr. Whyte, thank you so much for being with us. Congratulations on everything you're doing. I hope there's some more opportunities that we have that we can work together and do some
Absolutely.
fun things.
Yeah.
Now, one of those
I mean, go ahead.
I was gonna say, what maybe one of those would be we could go to Sebastopol and we'll go crash Ross Halleck's house and sit down and he can serve us some more of his Pinot Noir.
That would be good. That would be good. And I enjoyed our conversation, the time that we had prior to this, and I want to, thank you for all that you're doing. We need more folks to be involved in philanthropy and advocacy, and really address those folks who are the most vulnerable populations, who are most of need. And it's really a measure of, do we help people at the time that they're most in need? It's easy to say, oh, I can help people when they're fine, or it's not that hard, the logistics that you have to make all these things happen. But to help people when they need us the most, I think it is really a true testament to the impact that we can have. So thank you.
Absolutely. Well, thank you. And to everybody who joined us today, thank you very much. You can look for Dr. Whyte at WebMD. Look for Project C.U.R.E at projectcure.org. And we'll look forward to seeing everybody again soon. Thanks again.
Thank you.
Give the family a squeeze from all of us.
I will. I probably have to watch Ninjago now. If anyone
I love it.
I guess so.
Yeah. All right. Well, thank you.
Great seeing you. All righty.
All right.
Bye-bye.
Bye-bye.